Good morning, everyone. We will be discussing today the role of policy and law in healthcare. This is my presentation for Dr. Larry Johnson at Colorado Christian University. Some of the objectives that we will be discussing today will be what is health policy and law and its role in today's society, the domains of healthcare law and policy and why it is important, problems with policy and law, and why policy making is needed. First and foremost, what is health policy and law? Policy and law are decisions that are made to change and influence behavior in relation to health. According to our text, policy and law have always been fundamental in shaping the behaviors of individuals and industries, the practice of healthcare, and the environment in which people live and work. Federal and state level policy and law shape all aspects of our healthcare system. This goes from structure and organization, the service delivery, financing, and administrative and judicial oversight. There are different domains of healthcare policy and law, which include healthcare policy and law, public health policy and law, and bioethics. Healthcare policy and law cover access to care, quality of care, and finance. Here, it is based on an individual's access to healthcare. Is it cost effective? Is it quality care? Is the person insured? Public health policy and law is government regulations to protect the health, safety, and welfare of the general public. An example can be an idea of a blanket policy taken into consideration if a vaccine is of the best interest for the national security. These are some questions that healthcare professionals have to ask themselves. Bioethics are ethical issues with medical practice. This is where moral societal values, policy, law, and medicine all intersect. An example of the bioethics would be ethical issues that arise when it comes to assisting and the end of life or legalizing abortion. So why is policy and law important? Because it is for the safety of everybody. It protects all of the consumers as well as the healthcare providers and the healthcare organizations. It combats public health threats, ensures that compliance is being met, and creates a balance between public regulation and exercising rights. Some problems that do arise with policy and law would be policy and laws are not always in favor of the public. They may be made to favor economic interests of a privately owned company and not the best interest of the public. In some situations, government has to intervene, and that's not always ideal, as in many situations they cannot come to a solution. Healthcare laws are constantly changing. Many implementing the healthcare laws don't always take the time to understand the problem, and then consumers end up wasting time and money on an ineffective solution. So why is health policy and law needed? It's needed because it is essential to providing clarity with issues that are critical to health and safety, legal liabilities, and regulatory requirements. It does set a plan of action for desired outcomes in any healthcare organization. Delivery of safe and cost-effective quality care. It's for everyone's protection. These are my references for my presentation. Thank you for listening. Have a good day.